It is very nice to greet you again. In today's video we will talk about the following. What every dog owner should know about parvovirus. When your puppy vomits and seems unwell, it's natural to panic. While several conditions can cause these symptoms, one of the most serious is canine parvovirus. Understanding this dangerous disease is the first step in protecting your furry family member. I'll explain what parvovirus is, how it spreads, and the critical signs to watch out for. What is canine parvovirus? It's a highly contagious and deadly viral disease. It primarily attacks rapidly dividing cells in a dog's body, most severely affecting the intestinal tract and bone marrow. When the virus invades the intestinal lining, it prevents the dog from absorbing essential nutrients, leading to severe vomiting and diarrhea that result in severe dehydration, nutrient loss, and weakness. Damage to the intestinal wall can also allow bacteria to leak into the bloodstream, causing a systemic infection known as sepsis. Simultaneously, the attack on the bone marrow suppresses the production of white blood cells, crucial for fighting infections. This combination leaves the dog, especially a puppy, extremely vulnerable and seriously ill. How is parvo transmitted? Parvovirus is incredibly resilient and can survive in the environment for months, even under adverse conditions. It is spread by direct contact with an infected dog or, more commonly, by contact with contaminated feces. A dog can contract the virus anywhere in the environment that is contaminated. A public park, dental surfaces, food and water bowls, collars and leashes, the hands and clothing of people who have handled an infected dog. Because the virus is so resilient and spreads easily, it is a concern for any unvaccinated dog or puppy. Symptoms of parvo. Recognizing the symptoms of parvovirus early is crucial for a successful outcome. The signs can appear suddenly and worsen rapidly. If you notice any of the following symptoms, especially in a young puppy, you should seek immediate veterinary attention. The main symptoms of parvovirus in puppies and adult dogs include the following. Severe diarrhea, often with blood. This is one of the most distinctive signs. Vomiting. A common question is, why is my puppy vomiting? While many things can cause vomiting, when combined with other symptoms on this list, it is a major warning sign of parvovirus. Lethargy or extreme tiredness. Your puppy may lose all interest in playing. Loss of appetite. Refusing to eat or drink is a serious warning sign. Fever or low body temperature, hypothermia. Abdominal pain and distension. The most critical period for a dog with parvovirus is usually the first 24 hours. Puppies between 1 and 3 months old are at the greatest risk. Any dog, regardless of breed or age, especially those that are not vaccinated, is susceptible to the disease. Prevention is the best medicine. The most effective way to protect your dog from parvovirus is through prevention. This involves a combination of vaccination and proper hygiene. Puppies should receive their first parvovirus vaccination between 6 and 8 weeks of age, followed by a series of boosters every 3 to 4 weeks until they are at least 16 weeks old. It is crucial to complete the entire series, as puppies are not fully protected until after the last dose. Adult dogs should receive a booster dose 1 year after their initial puppy series and then, generally, every 3 years thereafter. Sanitation and hygiene. Because the virus is so persistent, hygiene is essential. If you have a young puppy that is not yet fully vaccinated, avoid public places where many dogs congregate, such as dog parks. Regularly clean and disinfect your dog's food and water bowls, bedding, and toys. Always pick up your dog's waste promptly. Long-term effects and recovery. What happens after your dog survives? The good news is that approximately 80% of dogs that successfully recover from parvovirus do so without long-term health problems. The remaining 10% may experience lingering issues, such as gastrointestinal sensitivity. Most dogs that survive parvo develop strong immunity that can last for years, possibly their entire life. However, because new strains emerge and immunity can wane over time, absolute certainty is never possible. Your veterinarian may recommend continuing with booster vaccinations every 3 years. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.